All right, good morning, everybody. Welcome to our second advocacy preparation webinar in preparation for our Advocacy Day for 2017, which will be held on April 18th in Madison at Bethel Lutheran for both members of Supporting Families Together Association as well as United Ways across of Wisconsin. We had our first preparation webinar a month ago today, actually, on the Early Childhood Advisory Council's 3 recommendations to the governor. And this webinar is intended to provide additional context about each of the partners and their memberships within the state. So Supporting Families Together and our members who are child care resource and referral agencies and family resource centers, and then also United Way of Wisconsin and the local United Ways across the state. Charlene is also on the call with me. Do you want to do your intro, Charlene?
Sure. Welcome this morning, and we're happy to have everyone on the call. This is Charlene Moulet. I'm the Executive Director at United Way of Wisconsin. And I am going to talk about a project that or initiative we launched and report that came out in September that kind of is the basis for our advocacy agenda and the work, a good body of the work that we're doing together as United Ways across the state. Jill, do you want me just to jump into that?
Yes, I think we are ready.
Great. So I have control of the slides. Let's see if they actually will move. So you may have noticed in September and early October, we were talking a lot about a new report that we launched called ALICE. ALICE stands for Asset Limited Income Constrained Employed, and really talks about those households in the state that are struggling to get by. It was important for us, first of all, for a couple of reasons to work on this initiative. One, it was, at least in recent times, the kind of first statewide initiative that we've taken on as a state association and with the majority of our members participating. And second, we have been hearing lots of feedback in communities that we need to provide a little bit more context to why there's so much discussion and chatter about families struggling to get by, and could we identify some of the causes for that struggle, and decided to take on the ALICE initiative here in Wisconsin. We are the 15th state in the United Way National Network to commission this study. The study originates from the United Way of Northern New Jersey in partnership with Rutgers University. And the United Way of Northern New Jersey developed these measures that I'm going to talk about briefly as a way of understanding their community more, and found that it really helped to create conversation in communities, kind of reset the conversation and reduce some of the stigma around households and families that are struggling, and to create some real change in their communities. And so that study now is being replicated throughout the country. Looking at challenges and problems in communities, we focus tightly on the individual. People's minds tend to consider what the individual is doing right or wrong, where they are, did they go to college, are they involved in drugs, did they get pregnant early, all of these things. We start telling this story to kind of help to understand what's going on with the individual. And just similar to this guy kind of struggling in the water here, we can start to tell a story as to what happened, why is he in this body of water, he looks distressed, does he not know how to swim, you know, did he get in over his head, like what's going on with him. But if we take a step back, and the ALICE report tries to take a step back to look at really what are the causes that could be the conditions that could be really affecting this individual in the water here. So our job is to help people see the bigger picture, and ALICE affords us the opportunity to do that, and if we can get the right awareness, can help us set the right frame for this research, and then ultimately to help change perspectives and attitudes. So it was important for us because this study was commissioned and undertaken by the United Way of Northern New Jersey and Rutgers University to make sure that we had a state-grounded research advisory committee. And thank you, Jill, for participating, as well as other individuals throughout the state that are experts in their own areas of study. And I think you'll recognize some of the names here. And this was a really good process to participate in, because these folks really took the study seriously, and their questions, they kind of pushed the researchers to understand Wisconsin data and ultimately the final product. So the study focuses on 4 measures, and I'm going to talk about the first 2, and then it's a compendium of over 250 pages of information that will help you in your own kind of understanding about families in Wisconsin or households in Wisconsin. But I want to talk about the first 2 measures today, since we have limited time. So the first measure is the household survival budget. And the household survival budget really focuses on 5 household essential budget items, 4 if you don't have children, the 5th being child care if there's children in the household. Each of these budget items is set at a very conservative level based on current research. So, for example, local housing is set using HUD information on the kind of most efficient conservative housing estimates. Child care is set based on basic in-home care, food based on the thrifty food budget from USDA, and so forth. Healthcare, I will mention, we're a pretty well-insured state, at least currently. The healthcare measure here assumes that a household can't afford to be on the exchange, and so therefore it really sets, based on the national data, what the out-of-pocket cost of healthcare would be, that average, plus the penalty for not participating in the exchange. So really the most conservative way of looking at a household budget and these 5 basic items. There's an additional budget item that is miscellaneous and basically takes 10% of each of these 5 and then also adds in taxes. So for the state of Wisconsin, you can see that the average household survival budget, this slide really looks at there's 6 household compositions. This looks at the high and the low. A single adult household being the lowest annual budget of $23,196, or a family of 4, which looks at 2 adults with 2 children in care, an infant and a preschooler. And the average statewide of the monthly household budget is $54,804. So the study then also provides, Fond du Lac was the last presentation I did, so I used this specific county slide. So the report also provides county level data and a county level snapshot, and there's a link to the Rutgers website where you can pull each county's survival budget and these 6 family compositions. So it's adjusted for county information as well. So based on those numbers, 42% of households in Wisconsin have an income below the ALICE threshold, and the ALICE threshold is the second measure. In Fond du Lac, the previous slide example, 33% of the households have an income below the ALICE threshold. You can look at this pie chart, and really what we're talking about, the ALICE threshold is the number of households that are in poverty, plus those households that are considered to be ALICE, those above the poverty line but struggling to get by below that threshold or living below that average household survival budget. The report also looks at, comparison to federal poverty level. It also sets these measures based on county averages for households that are over 65 years old and adjusts for households over 65 years old. And it's on a scale of 35,000 to 75,000, depending on which county you live in, because it costs less to, so if you're under 65, 35 to 75,000. If you're over 65, 30 to 60,000 based on the county you live in, because it's more expensive to live in some counties than others, as is obvious, and it's less expensive and theoretically to live if you're over 65 years old. The report also provides county subdivision information on the ALICE threshold. So this again is from Fond du Lac, and you can show the variability in the county subdivisions throughout that county in terms of the number of households and the percentage of those households that live below the ALICE threshold. So those that are considered to be ALICE, as well as those that are below the poverty line. This includes any county subdivision that has at least 100 households and could be measured. The report then talks about kind of over time how the ALICE threshold has fluctuated. So this chart tells us a couple of different things. One, it shows since 2007, pre-recession, and then coming out of the recession. Now, the last time we measured in 2014, the report will be redone, so we'll add 2016 information in here next year. It shows that this purple dotted line shows the number of households. So in this example in Fond du Lac, the number of households has increased slightly over that period of time, those 7 years. You can also see that pre-recession, the poverty rate in Fond du Lac County was 8%. Over the period of time, it has fluctuated, and in 2014 was 11%. You can also see the ALICE population, how that has also fluctuated, and not the typical story in Wisconsin, but a positive story for Fond du Lac. The number of households that are living above the threshold in Fond du Lac County has increased over that period of time. What we've seen in many counties is the number of households that are living above the threshold has decreased, and more households are either in poverty or in that ALICE grouping and struggling to get by. What we know about these numbers, as you all know, is this is a point in time. So at any time during a given year, households can fluctuate in, between any of these levels. So coming out of poverty, particularly if they're seasonal workers or maybe have viable work, and if something happens where their hours are reduced or no longer have increased costs, they can fluctuate between poverty, ALICE, and then even above the threshold. So this is really just a point in time. So the report also talks a little bit about where ALICE lives in the state, and this heat map really shows the number of households that are above 40% of the threshold. It also shows that the county with the highest level of households that are below the ALICE threshold is Menominee at 66%, and the county with the fewest households below the threshold is Calumet at 28%. The report also provides information about demographics, and the story and conversation that we often have in communities when we show this slide is about the different strategies that are needed depending on your kind of age bracket. So strategies to help households with a head of household under the age of 25 are different than strategies to work with older households with a head of household over 65 years old. So folks, it's not surprising that There are a larger number of households that are headed by somebody that's under 25 that are below the ALICE threshold. And so we look for strategies to make sure that those young earners, usually college grads or households that are just entering the labor force, are supported in a way that they can get through those early earning years and continue to grow skills, grow wages, and come above the threshold and be supported to stay above the threshold. The concerning part of this slide is that there are still a large number of households that are below the threshold, even in the highest earning years. And really, this gives a snapshot into communities to have conversations about what could be done to help support more households and manage those household budget items. And then what was different in our state than some of the other states that have undergone this study is the number of seniors that are below the threshold. Seniors traditionally are the least likely to be in poverty. However, in Wisconsin, they are very likely to be below the ALICE threshold, and to a greater extent than in some of the other states that have undergone this study. So it's something, again, for us to look at. The report looks at race and ethnicity, as well as families with children by income. Some of these tables are available at the county level, and some we're still working on getting the county level data. So we just have the statewide data, but again, good information. Typically when I do presentations in communities, and I think many of the local United Ways, when they do presentations, they talk about the consequences of living below the ALICE threshold. And we know that there's an impact on ALICE, the individuals that are living below the threshold, as well as an impact on the community when, and you know, our contacts with early years, when you don't have stable child care or you can't afford quality child care, that not only has an impact on individuals and children in homes, but also an impact on the workplace if for some reason you can't go to work because you're dealing with child care issues or having a hard time finding reliable child care. For each county, there's a snapshot of the ALICE households in that county, and this snapshot includes a couple of additional items. The most significant or relevant is the kind of economic conditions and this economic viability dashboard, which attempts to look at housing affordability, job opportunities, and community resources, and give a score based on whether those counties are you know, poor, fair, or good at those three measures in terms of the number of households, for example, with housing affordability that have less than a 30% housing burden for either renting or owning a home, job opportunities, the kind of economic context, and then a look at community resources in terms of supporting households that are below the threshold. So that's a very quick kind of overview. The last couple of slides here is just a way that the United Way of New Jersey has framed their community impact work with ALICE. I've adjusted that slightly to talk about how the United Ways in the state are starting to talk together about how to connect ALICE to early years, and particularly to the 3 ECAC priorities. So you can see by these statements, and I don't know if everybody has access to the slides, so I'm just going to read them real quick, the way we're kind of looking at it and some of the messaging that would help on this Advocacy Day. So for example, ALICE has access to affordable, high-quality child care. ALICE has access to affordable early childhood education. ALICE youth learn in positive, supportive school environments, preparing them socially and emotionally for the future. ALICE families who are struggling benefit from high-quality home visiting programs to identify risks early, connect to needed services, and promote overall development, health, and success of a child for life. ALICE households have access to information, education, resources, and services in the community and the workplace. So that's some examples. These statements we're working on as a United Way network between now and the Madison Day to kind of have our message points and how that connects in the early years connects to ALICE and ALICE households and helping them to be better supported and move more households above that threshold. So I think we have time for a couple of questions if we have them, but just wanted to give you, hopefully it's a helpful context for ALICE and how that relates to the work that we're doing together. Any questions? Is everybody awake?
We're here. Charlene, this is Jill. I loved at the end how you kind of summarized it and brought it back to some of the early childhood topics we've talked about together. I'm wondering, in terms of reactions you've already received from legislators, or like types of questions that might be helpful for people to prepare?
Good question. I have not, I've had some early conversations with legislators and the feedback has been positive. I don't know if there are any of our United Way members on the call that have had other conversations. I can say that as I've probably done a dozen, 18 presentations in communities in the last several months. The questions that we get are, well, first of all, comments have been overwhelmingly supportive, and it doesn't really matter the audience. The comments have been supportive in terms of helping to understand context. And questions have been really about sometimes why are families that are living below the threshold not taking advantage of the services that are available. We've gotten some of those kinds of questions. We have gotten questions about specific pieces of data, but for the most part, it's just been comments and stories. People have really opened up about the story of why they're struggling to get by to help understand. So anybody that's on the call from United Ways that has talked to legislators specifically and questions that you might have gotten?
This is Liz. I spoke with Jen Schilling last week, and she found it very useful and loved that it was broken out by different communities and different counties so that she could help point other legislators in the direction of what's going on in her own communities.
I think because the report's helpful in a couple of different ways. There's lots of data. The data is not new information. It's not a spin on the information. It's really just taking it and putting it within this frame. So it's hard to argue with the data. And there are approaches that individuals can take to help support ALICE households and systems can take. And so really opens up to connect to really kind of anybody's concern and help lead a conversation to what could be done to help support ALICE, anybody below the threshold, whether they're below the poverty line or below the survivability threshold. Trying to break down the stigma, again, of why somebody might be in that situation and trying to address remarks to solutions. Any other questions? We will be bringing a one-pager that's focused on early years and the ECAC recommendations, kind of focused in that way that connects to ALICE, as well as Anybody that's coming to visit with legislators will bring their county pages, that would be in that legislator's kind of jurisdiction. And certainly any of you are welcome to use that information as well. If you're not from a United Way or not partnering with the United Way on that day, if it's helpful to you. We also have extra copies of the report, and the report can be downloaded.
Thank you so much, Charlene, for sharing that. And there's so much information. I think every time I look at it or hear the presentation, I learn something new each time because it's rich. I am going to try to smoothly swap screens here. And I hope that now everyone is able to see a slide that has the SFTA logo on it. Can someone verify for me?
Yes.
It's there. Wonderful. Thank you so much. Kind of similarly with when Charlene and I were talking about prepping for this webinar, we really wanted to make sure that there was the shared familiarity and context with some of the additional kind of background as well as objectives of one another's organizations and partnerships. And so really for Supporting Families Together Association, I can't really talk about us without talking about our members. So you're going to be hearing a lot about child care resource and referral agencies and family resource centers over the next 20 minutes or so. Recently, Supporting Families Together Association went through our strategic planning process, and we made some revisions to our mission, vision, and purpose. And so up on the screen you'll see that we see our mission as cultivating a system of organizations and professionals across Wisconsin to promote quality, strengths-based early childhood services in all communities. And we envision that in every Wisconsin community, all children have the opportunity to reach their highest potential, and that all adults understand their role and responsibilities to children. And so that really creates for us the whole purpose of doing this is aiming to optimize that developmental window of opportunity that early childhood presents for building a strong foundation for life. I think because we've all found this common ground around early childhood, we understand how much is happening in those first 5 years of life and prenatally that lend such a great opportunity for creating social change so that we achieve the outcomes we're looking for within all of our communities and as a whole for society. And so the other theme that I like to highlight with our mission, vision, and purpose is that it really is all about this two-generation approach. We know that children don't live in silos. They have people in their lives, and the most important people in their lives are the adults who care for them. And so our membership is structured as such that we want to make sure that we are supporting families, parents, as well as early educators or caregivers. And that's where you might have seen this emblem. So Supporting Families Together Association, we're still relatively young. We're just coming up on 10 years at the end of this year, actually. And we came out of a merge of previously existing child care-oriented organizations. And at that time, we had funders who were talking about the fact that on the early care and education side, paralleled and mirrored a lot of the same messages in the family support side. It was just a different audience of who we were trying to connect with, whether an early educator or a parent. And so that's where this idea of a shared association for family resource centers and child care resource and referral agencies came out of. And of course, we can't neglect communities because they're such a foundational component to how these organizations do their work. So that's where you see these three spheres of influence, if you will. And then this nicely parallels to those organizations, and the communities have their own specific stakeholders that then overlap as well. So we see that directly translating to families, early educators, and citizens, and this is such a key point when we talk about our advocacy roles. The huge asset, I would say, that this organization and this network has with all of our members is that we have reached to those who are our voters, essentially. They have connections to their elected representatives, and I think that that can be looked at as a major resource, whether completely tapped or just starting to be tapped. When we talk about priorities, you know, the realm of everything early childhood can become quite expansive, and so to try to wrap our heads around it, we often use these 4 kind of areas. We have quality early learning experiences that they're not limited to school, but are often seen across settings, and so some of our work that really is embedded here are resource and referral services, as well as Youngstar, the state's quality rating and improvement system. We also talk about strong families and the concrete support that every family needs at some point in time, and that may be around parenting support and education. It may be in the form of home visits. It may be in the form of concrete basic needs. So we always want to make sure that we're promoting strong families and factors that are protecting those families. We also have initiatives that look at healthy children, whether it's looking at an obesity prevention focus to a developmental screening to social emotional outcomes. It's quite expansive as well. And then lastly, when we talk about responsive systems, we're meaning that our supports, our systems, our resources are responsive to all children in Wisconsin. So it's taking into account their neighborhood, their community, their cultural background, their linguistic needs, and that those principles and values are embedded across the work that we do. So diving into our membership a little more deeply, I mentioned that we have our 2 kind of branches to membership, which is also becomes a little more complex, but also even more beneficial in terms of we have agencies who are both, which is a really great joint model as well. So we have standalone family resource centers, joint family resource centers, and child care resource and referral agencies, and then standalone child care resource and referral agencies. So we'll talk a little bit about each of those, but starting with our family resource centers, our role with FRCs has evolved a little bit differently in terms of when we first started out. I'll talk about the CCNRs in a minute, but we are actually a fiscal agent and contract manager in that role. This is not the case for family resource centers, and a lot of our work has focused on professional development and networking. And providing other supports. And then we currently do have 37 members that are family resource centers. Again, some are that joint FRC and CCRNR model. And however, even outside of those family resource centers, we know there are additional family support type agencies that we're continuously trying to connect with. And then that family resource center side, I would say, has a range of funding structures and unique infrastructure within themselves. So I've heard said at the national level many times, you've seen one family resource center, you've seen one family resource center, because they do look quite different based on local community need. And so we'll talk a little bit more about that later in the presentation too. And then when we're looking mostly at a statewide level and networking, I would say we also have connections to national entities. And one of those on the family resource side is the National Network of Family Support. And so we do have a reach that goes to the federal level and making sure we understand that national context too. On the child care resource and referral side, we have 10 agency members who cover 8 regions that then in turn cover all 72 counties and 11 tribes in Wisconsin. As I mentioned before, the child care resource and referral agencies work together as a network and system to deliver several different types of statewide services to early care and education programs and providers. That includes the administration of Youngstar and delivering a high volume of on-site consultation as well as training, professional development supports, and helping to programs to use their microgrants in the ways that meet their individual needs. CCR&Rs also provide a lot of consumer education and technical assistance on the family side as well through child care resource and referral services. And then, of course, similar to FRCs who have different funding structures and will look differently, this is true for child care resource and referral agencies as well. They have many unique programs that have been cultivated and created really in the image of that local community need. And then similarly, the CCR&Rs have a national entity too that we're connected to, and that is Child Care Aware of America. So that's a very brief covering of the two sides of membership that SFTA engages. So please know there is a lot more information, and I'm happy to provide more information or connect you with your local FRCs or CCR&Rs if you are not one of those, or if you are. So more information I'm sure you'll be learning throughout this, the rest of the webinar, as well as during Advocacy Day when you're with one another. So I wanted to get a little bit more into our current policy agenda and what this looks like. So we have currently had with our members a stable policy agenda for multiple years. We have seen progress on different pieces, but really our intention has stayed the same. So we will probably be coming up soon on needing to reevaluate, but wanted to give you the context that we do have a process we use. And so this has been in the form of generating potential items for our policy agenda while we're together, face-to-face. We've used a basic priority voting to see what emerges as the highest priorities. And then we use filters around impact, feasibility, and urgency. We did this in the form of a survey with our last round to really narrow in and focus on what are the highest pieces that we're going to be looking at for our policy agenda. We always, evolve in processes, and for example, our membership on the Family Resource Center side was opened up to more Family Resource Centers as part of our history. We used to be specific to Children's Trust Fund grantees, and over time that has changed, so that really broadened that FRC membership. And then, of course, almost all of our, actually I believe all of our members are private nonprofits, meaning that they have constraints and limitations with their 501c3 status. Of course, I'm sure that's the case for United Way's, as well as funding constraints when you have federal funding or state funding. There's constraints on what you're able to do. So advocacy is always kind of has those considerations and making sure that our members are comfortable with the level of advocacy we're doing versus other types such as lobbying. So just a little bit of context there. So here we get into our current policy agenda, and you'll see we've broken it down into kind of two areas. One being high quality and accessible early care and education, and the second being high quality accessible family support. So I'm going to dive into two of these in more depth on the following slides. So I'm going to skip over for now the increased funding for CCR&R-based services and the increased investment in FRC services. But I'll highlight the other pieces to know where we are in policy and the agenda as a whole. So in terms of increased investment in quality, we've seen that in the first ECAC recommendation around investing more in Young Star and these quality maintenance and achievement awards. But I think we see a lot of other components come into play around that increased investment. I think a lot of the components that come up when we talk about childcare as a whole, but then particularly with quality too, is that we're seeing these tensions being pulled. And I think we mentioned this on the ECAC webinar as well. But the fact that we know that quality childcare has costs, we're really pushing for higher qualifications in staff. And those have kind of both unintended consequences associated in terms of with more qualified staff. Those staff have more options and may be looking for folks. The other competing effort is that compensation is not matching yet where that qualification comes from. And again, the compensation is tied to the cost of care. So we're in this place of not being able to ask families to pay more for childcare. As with Charlene's presentation, we just saw that childcare is a huge cost to families, and especially those with limited incomes. It's just not possible. So we see these tensions being pulled across: turnover in staff, the need for highly qualified staff to meet quality standards, the need to pay those staff but make costs manageable to families. So that's a lot of what I would say informs policy, that we need to think about solutions that are going to support the business model of child care and a business model that values quality. This is really kind of more of a maintenance, making sure we understand what's going on with implementation and that we're seeing the right things happen for families. So one of the things that we were very delighted to see with CCDBG was the fact that authorizations for Wisconsin shares had to be that 12-month eligibility period. So there's lots of details there. I won't get into those, but it does a lot for families in terms of creating continuity for children, family child care received only reimbursement and shares for the hours that a child actually attended. So that creates pretty tough business model parameters, because unlike, for example, if you went to a doctor's office and you canceled at the last minute, you're often going to have policies that still charge you. Well, that wasn't the case, so then all of a sudden you can't fill that spot because you didn't know the child wasn't going to be there. And you're losing revenue, essentially. So the good positive news on this attendance-based only policy is that it has been eliminated with the adoption of My Wisconsin Child Care, which is also known as Wisconsin Shares EBT or Parent Pay, which you see below. Now that has been rolled out to all counties except for Milwaukee County, which will be rolling out April 1st. Quickly on that note, with Wisconsin Shares and EBT, I think that's where we are also in an implementation phase where we're really keeping an eye on how this looks, particularly to how the Young Star adjustment is being addressed. The Wisconsin Child Care Administrators Association did a lot of heavy lifting and advocacy work to assure that the Young Star adjustments, or tiered reimbursement, or bonus, however you have heard it, for those who have achieved 4- or 5-star ratings and get a higher reimbursement rate. Right now, that adjustment is given directly to the providers versus being put on the card for the funds that go to the parents. And so they advocated very strongly for that, and it is continued. So it's kind of in a process of making sure how does that implementation roll out, and to see the continued support. And then in terms of tiered reimbursement, that is one element of the tiered reimbursement aspects, but also we do know that as of now, 2-star programs take a 5% decrease, as well as 3 stars staying at the regular reimbursement rate. So how could tiered reimbursement be used to incentivize quality even more? So those are some of the considerations. I would say the last one on Wisconsin Shares reimbursement is also that the reimbursement rates are very low right now. They do not even come close to the 75% marker that is recommended from the feds, and also that many advocates would say is needed for a strong, solid child care or supply. So that's kind of on the quality and accessible early care and education side. On family support, really honed in on two pieces. The one I'll highlight right now is the increased investment in evidence-based home visiting. As we mentioned, this is an ECAC recommendation as well from the last webinar, and that right now in the governor's budget, there has been a proposed increase of $3.9 million annually. That is a flat annual amount, so it's not as though 3.9 added and then another 3.9 added and then another. It is just 3.9 added each year. So this is also coming at the heels of a federal cut that was about 20%. So this increase does make up for that cut and adds a little, but there's still room to grow. So definitely thankful it's in the budget, but we know that the number of families who would benefit and would want these services is not being met by what we're able to provide at this time. So these are I'm going to go now into the two that I skipped over on the last slide because they're a little more, I would say, salient for us. So increased funding for the CCR&R-based services. I mentioned the resource and referral services earlier, in this contract with the state, it really creates a basic level of service for the state, for families to be able to get information and referrals for child care so that they understand what regulation is, what quality is, and have access to technical assistance and other supports in searching for care and other early childhood issues that come up for their family. It also provides some technical assistance to providers and to communities. So that base contract has been a pretty significant and meaningful contract for this system of child care resource and referral agencies in terms of it has supported an effective network that could be built upon to expand services, promote quality, and such. However, well, one other quick note is that funding for these base services is through Wisconsin's Department of Children and Families, and it's with dollars from the Child Care Development Block Grant at the federal level. So with the importance of how we see this contract in building a network and creating really solid service delivery, it is also faced with flat funding for over a decade. And I believe, it's my understanding, that the last change to the funding was actually decrease. So we are currently looking at a contract that has the minimum funding required by state statutes. And so this is really tough. I mean, just again, I feel like I've been talking business model a lot without those increases that even reflect just basic inflation or anything, let alone the growth in the field and the growth of quality and the needs that are out there from families and providers. It isn't sufficient. So this is definitely a high concern in our minds and how we want to be moving forward in our work. We will be looking at advocating for increases to this contract. I think the other contextual factor here is that with the most recent RFP process, is actually the first RFP process for child care resource and referral services, there was a change in funding formulas, so that resulted in decreases for many agencies as well, even within the contract. So while the whole thing stayed the same, agencies did feel a difference. So I think those are really important pieces that we're thinking about as how we do our work, including how we move forward in our advocacy efforts. And then on the Family Resource Center side, I kind of mentioned how critical that base funding was to create a strong network to be able to have statewide service delivery. And so right now there is no specific funding dedicated to base Family Resource Center services, which would be super beneficial to create this strong network and system, but also really beneficial in creating strong, solid organizations. Right now, many family resource centers rely heavily on local funding. Many are funded by United Way, which is such a benefit, and we love that local involvement. However, the diversity in funding that can come with larger state-level grants really makes a difference in organizational health as well. So right now there are a couple of opportunities, including the Family Foundation's evidence-based home visiting, as well as several grant opportunities from the Children's Trust Fund. But those are competitive grants that are not, they do not cover the entire state or ensure that families have access to family resource center support statewide. So where we would see benefit, and these elements actually came from a group of family resource centers creating a vision of what a strong network and system would promote, is that a type of base funding for family resource centers or stronger investment could create a seamless service delivery system. It could create and promote strong and stable investments over time. It could create accessible support, and what was really meant by this means that it's all families have access when they need it, that there's no stigma, that we're able to really meet high needs, but also not allow families to feel stigmatized or demeaned by taking services, because we know that every family needs support in one way, shape, or another at some point in time. It also could create a reliable system throughout Wisconsin, really promote an atmosphere of stewardship for others to invest and create that diversification in funding that would mean a commitment over time, so that there wouldn't feel like hardships are around the corner for family resource centers, and that we'd be able to promote policy at multiple levels that are truly supportive of families. So that's a little bit on what a vision of a network of family resource center services could offer. And then in closing, this is a little bit of what our message has been in the past. So of course, kind of refocusing that to take into account the ECAC recommendations, but the fact that visiting as just a couple of those options. So I know that I just took us right up to the end of our webinar, but I want to open up for any questions to folks, because I know that was a lot of information. Or I can take it that I did a great job and covered all the details, so there are no questions. All right. Well, if you do have questions, I'm going to put up contact information for both Charlene and myself. We are going to be moving forward with our next steps on planning for the Advocacy Day. Again, it is April 18th. I know many of you have already registered. We'll send out the registration flyer again with the recap of this webinar. I just saw a question come in from Patty, if we'll provide the electronic versions of both of the PowerPoints, and we sure will. With the last webinar, we were able, because this is being recorded, we are able to post it online, and we'll post the PowerPoints with it. So that will be available to you to share with any colleagues who weren't able to make it in preparation for Advocacy Day, which is again April 18th here in Madison. Registration is out and available. We're going to be starting to coordinate the legislative visits that will occur in the afternoon very soon, so please do get your registration in. Of course, if you have to register a little later, we'll still be making those arrangements for you, but we'll get a head start on it very soon. So Any other last questions about either presentation or upcoming Advocacy Day? All right, and Charlene, do you have any closing thoughts or remarks?
No, just thank you, everybody, and we look forward to Advocacy Day.
All right, thank you everyone so much for your time today, and we will talk to you soon. Bye-bye.
Thanks.